Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Ages and Stages questionnaires assess developmental performance in young children. It evaluates 5 key domains: communication, gross motor skills, fine motor skills, problem-solving abilities, and personal social interactions. The main purpose is to identify children at risk for developmental delays or disorders such as speech and language impairments, motor deficits, or cognitive challenges. The tool facilitates early detection to enable timely intervention and support. It is validated for children from 1 month to 66 months of age. The questionnaire relies on parent-reported information, making it practical for routine developmental surveillance in clinical settings. Its use contributes to improved developmental outcomes through early referral and management. The Ages and Stages questionnaires are indicated for children from 1 month to 61 months of age. They are designed for use in populations at risk for developmental delays, including premature infants, children from low socioeconomic backgrounds, and those with known medical conditions affecting development. The tool is most useful in pediatric primary care and early intervention settings to facilitate developmental surveillance and screening. It aids healthcare providers in identifying children who require further evaluation or referral to specialized developmental services. Studies demonstrate sensitivity ranging from 85 to 95% in detecting developmental concerns across communication, gross motor, fine motor, problem solving, and personal social domains. The administration of the Ages and Stages questionnaires involves providing caregivers with a standardized set of 30 questions. These questions cover 5 developmental domains: communication, gross motor, fine motor, problem solving, and personal social skills. Each item uses a response format consisting of 3 options: yes, sometimes, or not yet. Caregivers select the response that best describes the child's abilities over the most recent period. After completion, each response is scored as 10 points for yes, 5 points for sometimes, and 0 points for not yet. Scores within each domain are summed to obtain a total domain score. These scores are then compared against established cutoff points derived from normative data specific to the child's age group. Scores above the 15th percentile generally indicate typical development, while scores between the 2nd and 15th percentiles suggest monitoring or follow-up. Scores below the 2nd percentile indicate the need for further assessment or intervention. This scoring framework allows practitioners to identify potential developmental delays efficiently and to prioritize areas requiring additional support. The Ages and Stages questionnaires demonstrate variable sensitivity and specificity depending on the study and population. Sensitivity refers to the tool's ability to correctly identify children who have developmental delays. Specificity indicates the capacity to correctly identify children who do not have delays. Reported sensitivity values for the Ages and Stages questionnaires range from approximately 75% to 85%, meaning the tool correctly detects developmental concerns in about 75 to 85 out of 100 children with delays. Specificity values typically range from 75% to 90%, indicating that 75 to 90 out of 100 children without delays are correctly classified as typical. For example, in a clinical setting, a sensitivity of 80% means that 4 out of 5 children with a developmental delay will be identified by the questionnaire. A specificity of 85% implies that 15 out of 100 children without delays might be falsely identified as having a concern, which may lead to additional assessment. These values underscore the importance of using the Ages and Stages questionnaires as a screening rather than diagnostic tool, prompting further evaluation when indicated. The Ages and Stages Questionnaires were developed in the late 1980s by Jane Squires and Diane Bricker at the University of Oregon to provide a practical and cost-effective screening tool for assessing developmental progress in young children from 1 month to 61 months of age. Extensive validation studies have demonstrated the tool's reliability and validity across diverse populations. For example, Squires and colleagues reported internal consistency coefficients ranging from 0.8 to 0.95, indicating strong reliability. Concurrent validity has been established through significant correlations with established developmental assessments such as the Bayley Scales of Infant Development and the Denver Developmental Screening Test. Several large-scale studies have confirmed the instrument's sensitivity to detect developmental delays, with figures commonly reported between 85% and 95%, and specificity rates ranging from 75% to 85% depending on the population and domain assessed. Furthermore, cross-cultural research has supported the adaptability of the questionnaires, with satisfactory psychometric properties observed in translated versions used internationally. The ongoing accumulation of empirical evidence and revisions by the original authors and subsequent researchers underscore the Ages and Stages Questionnaires as a scientifically grounded and rigorously tested developmental screening tool. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.